Thank you to Pastor Zama, my friend, my sister, our pharmacist. Yeah, she's a pharmacist in Crawley, and the best one actually. But then she's not there, but we still know her. Thank you, Pastor Zama, for all you do for this community and beyond. Dr. Patience Okorie. I'm a local GP. I am a GP partner at Lee Croft Medical Practice. I'm a clinical director with NHS Sussex. I lead on children maternity services as well as health inequalities. I'm also a member of the Southeast Clinical Senate, where I sit on very important matters across the Southeast. So I'm going to talk about things that I have been opportune, the privilege to know about, especially as it relates to people who look like me and you, not just because I'm female, but as well as the fact that we're black. That's the truth. And other minority ethnic groups. So I'm just going to be, before we start, I'll say, because we're Christians, the Bible also gave us, it empowered us and said, my people perish because they lack knowledge. So God has given us everything. And I say that to the young people amongst us today. I'm really pleased to see that we've got young, the ones that are not so young, the ones that are older. So it's a mix of age. So I'm just so pleased that we have them. God has given us everything, and we're especially and wonderfully made. My first slide, please. So, well, yeah, whilst they're trying to get that ready, yeah, I'm going to be talking to you about things to empower us to be well at every stage. As you can see, we've got the young people here today, the teenagers. Special acknowledgement to all of you. And we've got the women who are not that young, but they're very young in some respect. And then we've got the grandmothers. So that's 3 generations there. So it's about how do we empower people at different stages to live the best life that they can live, and with all the opportunities that are around and all the things that have been put in them. That's what we're going to be talking about today. Next slide, please. So we want to understand, prevent, and manage women's health issue. Why are we talking about women's health? You possibly say, what about the men? What about everyone else? Women are unique, very, very unique. So actually, even the NHS England recognized that, and in 2023, there was a women's health strategy. Initially, it was a green paper, and now it's a white paper. That means it's gone through all of the rigorous things that needs to happen, and it's now recognized. And what it's trying to address very specific women's health needs. And those are a few of some of the things we're going to be talking about today. Next slide, please. That's who we are. That's what makes us special. For those who are really young, you might not know that years and years and years ago, women were not allowed to. We didn't work, we didn't have jobs. So we stayed at home, we looked after the children, we cooked, we cleaned. That's all we did. And for some people, you also would need to know that women were not allowed to vote years ago. So we were not allowed into a lot of things. And then some very powerful women, they fought for those rights. And now we have equal rights as the men. You can go to work, you can vote, you can be seen anywhere, really. Women, as you know, women are now, we've had our prime ministers who are women. So very powerful people. But also that comes with a lot of challenges. So when you're a woman, you're not just a politician, you're not just a doctor, you're not just the woman who works at Tesco, at the tills, who is attending to all kinds of people, really stressed by the day job. When you get home, life does not stop. It actually continues. So that's who we are, juggling everything, the home, the job, the relationships, family, friends, and all that is expected of us. And sometimes it's really difficult. And in the middle of that, we can't deprioritize some things, which is most often our health. So the next slide, please. So women make up 51% of the UK population. That's more than half. So we're very significant people within the population. So we should never be an afterthought, and we're not. which was why the Women's Health Strategy came out in 2023. Health needs change during the course of life, but they are predictable. From when a child is born, remember it says that all our eggs are made within the ovaries when a child is born. So it's already started even when they are inside. So it's predictable that a young child will go through all of the things, periods, and eventually all of the things that come with being an older young lady, being a young lady, and then an older woman. So all of those things change, and therefore we have to have things that will meet the requirements at every point in those stages. So what are our health priorities for women? And I'm talking about NHS England. We're talking about reproductive and sexual health, mental and emotional well-being. I've got Kike, my friend today, who is a psychiatrist, who is going to talk about that. Cancer prevention and screening. Next slide, please. So we'll talk about reproductive health, and we're talking about from menstruation for the young people. It's a very physiologic thing. When I say physiologic, I mean it's just natural and it happens to people. If you're a woman, at some point in life, everything changes for good because you're growing older and then you have a period. But with it as well, sometimes it comes some problems. The period's not regular, the period's painful, the period's too heavy. All of those things, it's always good to talk about them. You can talk about them with your parents. You can make an appointment to go and see a healthcare professional. So don't sit on them, don't keep quiet. Contraception and family planning, we're talking about the women of childbearing age. It's good to give your body, you're in charge of your body, you're in control of your body. So you should be able to take decisions that relate to your body with some help for yourselves. So you can talk about contraception, you can talk about family planning, you can talk about the pharmacy with your GP, sexual health clinic, and there goes also fertility and pregnancy. Some women who struggle with falling pregnant. As much as it's meant to happen, it doesn't happen so easily for some women, and it's all right to go and see someone to seek help. So don't sit on it, talk about it, take action about it. And when we talk about pregnancy care, vaccinations in pregnancy, registering early, the reason I said that I sit on the Southeast Clinical Senate is there are stark health inequalities that we've seen, and data shows us that Black women are amongst the ones who they register for pregnancy care. They are the group of people who registers the latest. So it's expected that as soon as you find out you're pregnant by the 8th week or so, after the first missed period, you should contact your midwife, contact the GP. But we register late. We're not sure why, but that's it. But if you register late, that means you start on the wrong footing. You might not get everything that you need, vaccination, screening, and all of that. So it's really important that we do that. Going to talk about menopause symptoms and management later. It is something that happens. It's like puberty. So I talked about young people when they go through puberty. At the other extreme of life is menopause. Yeah, so at both stages, women struggle, and it's real. Next slide, please. So with menopause and beyond, we talk about physical and emotional changes. Physical changes because when a child is born, they're really small. Remember, boy or girl, they are small, they've got no teeth. Then they go through all the different phases in life. When a baby comes out sometimes, I have to say some of them, they're scrawny. Some of them are really tiny, shriveled, all sorts of things. And it's the same. Then they just evolve, they're beautiful. And it's the same thing. Our body just go through changes. We get to our prime, pretty and all, flat-bellied, muscles, all sorts, just name it. Then we go through the other side. When we get to menopause, the body changes and we're aging gracefully because of the hormonal changes. And it's really important that we recognize that, embrace it, and look at all the supports that might be available. Talking about hormone replacement therapy, in the past, they said to us, they're not safe, they give you cancer, but now we're saying it is safe. It's not only that it boosts the estrogen, that's the main female hormone, but also the fact that they help cut down your cardiovascular risk. Women who develop hypertension, for those who are prone to it genetically, when they get to menopause, the cholesterol will go up. That's the fat content of the blood. It would go up in menopause. So it's been found that the HRT, which is the hormone replacement therapy, would reduce the risk of a woman developing stroke, heart attack, hypertension. So it's no longer that don't have it, it's not safe. It is safe because a lot of tests has been carried out on it. It also cuts down cardiovascular risk. So you can manage your symptoms naturally, don't get me wrong, because there will be people that it won't really bother them. Just the same way that sometimes when a girl goes through puberty, some find it really hard, some don't. It's the same for women. But wherever you find yourself, just know that you're not alone. And then two, there are answers, there are options, there are supports that you can get medically and even in some group therapy. So it's important that we reach out to get some help if we need to. Next slide, please. So physical activity, that's the most talked about now, and it's really good that now it's everywhere. You can access them online. So that's talking about exercise. So exercise, some people go to the gym. Some people don't go to the gym. Going to the gym is not the only way you can exercise. You can dance. You can run around your own home. You can do squats and all kinds of things. But it's been proven that physical activity is the miracle cure. It reduces breast cancer by 20%, cardiovascular disease, that's stroke, heart attack, hypertension, by up to 35%, colon cancer, dementia, so depression, hip fractures, type 2 diabetes. So just name it. If you exercise, you're less likely to develop any of this. And even if you do, the outcome is better. Next slide, please. So health screening. I talk about health screening because people always say, so what's that? It's the process of just identifying people who could be at risk of certain diseases to help them keep healthy. Health screening prevents illnesses. And in the NHS 10-year plan, one of the things they are trying to do is to move from treatment to prevention. So they don't want us to develop that disease before we begin to take action. They want us to prevent a lot of them, hypertension, diabetes. The cancers as well are preventable from all of these exercises and the other things we've talked about, vaccinations. Next slide, please. So these are the preventable conditions, as I said earlier: diabetes mellitus, hypertension, cancer, abdominal aneurysm. Don't worry about the big word. It's often in men, but it also happens in women. The NHS provides health check for people between 40 to 74 years every 5 years, and you don't have to have any disease conditions to qualify for this. So contact your GP. So I'm going to go to cervical screening. That's the one that is most common to women, and most women from 25, you'd have got a letter at some point to say, come for your cervical screening. And if I say put up your hands if you go for cervical screening, I know we won't have so many hands up. So I'm not going to say that, but I just want to say it's not comfortable, slightly uncomfortable, but it's totally one of the things that we owe ourselves to have done. I do not know how many people in this room who remember the story of Jade Goody. That's a long time ago now, so yes. So she had cervical cancer and she died. So cervical cancer, we have screening for women from 25, and it's every 3 years. And it takes about 5 to 10 minutes. I go for it. It's not comfortable, but it's something that needs to be done. And you can speak to your GP, speak to the nurses, how you want it done. Some people now actually say, can I have the speculum so I can put it by myself? So it's very flexible. Don't shy away from it. Please do go for it, as it's a lifesaver. I'll tell you the story of a woman recently. I saw her and she came for something else, and I said, have you had your cervical smear? Oh, I don't like it, she said. It's too uncomfortable. And I said, do you want me to try? And we did. And it's the first smear she has had in 10 years. And then didn't see her again, but she left a message for one of my colleagues to say, can you please thank Dr. Okorie? I have cervical cancer, but it's in the early stages. So that's where screening comes in. It would pick up things in the very early stages. That's what screening is about. So please do go for it. So cervical cancer is the 14th most common cancer. So we have 32,000 new cases, as you can see, on a daily basis. And it's preventable, as I said. We now have also the HPV vaccine. The HPV vaccine is given in secondary school. We had a lot of communities not wanting for their children to be given this because they felt, oh, that means my child is licensed to have sex. This is not what it is. The HPV vaccine prevents cervical cancer, and also they've extended it to boys because it's been found that a lot of oral cancers are also linked to the virus that causes cervical cancer. So we've decided that it's good for boys to be vaccinated. So please, if you get a letter from your child's school to say, please, can you give consent for this? Please protect them. It's one of the things you owe them. Allow them to have it. It does not make them promiscuous. It just means that you're taking yet another decision that would give them good life and prevent cervical cancer or oral cancer. Next slide, please. So breast cancer. Breast cancer is the most common cancer in the UK. It's commonest over 50 years. However, there are some women who will have breast cancer. I think the youngest I've seen was a young lady who was 25. There is screening for it. There's mammogram. It's every 3 years. You get a letter from when you're 50. The other thing I want to say is breast cancer is one of those things that we can actually look out for by ourselves. Because as I said, it's common over 50, but it doesn't mean that people don't get it below that. In the black community sometimes as well, people do not engage with screening. They're just too busy. So they don't respond to the letters and they just let it go. I attended a funeral not too long ago, and it made me really sad because it was a lady I knew. I knew her for about 16 years or so, and I know that she had breast cancer. And I also knew that when she first found out, she found a lump. She delayed things, even when they are told I was breast cancer. Sadly, she didn't want to engage with treatment, and that's not the first one I've seen. I've also had people, patients, who would say, I do not want the operation when they offer it, and eventually spread, and they're still engaging with treatment. What I said earlier, the Bible says that my people perish because they lack knowledge. So, breast cancer happens in men. They also have it. It's very rare, but it's something that can happen. So the screening, self-breast examination is really, really important. You have to know what your breast feels like. What does normal feel like? So that when you find anything new, you'd pick it up very quickly and you'd recognize it. But you don't stop there. You action. You go. No matter how busy you are, if you have shifts that you have to be at, then please do go. Because you're running for the shift, you're running to get paid, but who is going to spend the money? So you owe it to yourself to look after yourself. We owe it to ourselves to look after ourselves, because when a woman is down in a household, everything is down, and that's the truth. So that's self-breast examination. You need to be breast aware. Know your own breast. Self-examination, often best after the period, not before the period, because sometimes before the period, the breast can feel a bit lumpy, and every breast is different. So it's good to know what yours feels like. As I said earlier, you would get mammogram invitation every 3 years from when you're about 50. And sometimes these days, I've had patients who got the invitation at about 48, 49. Please do go. Do not ignore it. That's what I'll say. It detects early breast cancer. Next slide, please. So tomorrow in Crawley, one of my friends who I used to work with, she was a GP with us at my practice. She's doing this health screening bus. So there's going to be a bus in the middle of Queen Square. Queen Square is where you have the water things on the floor. Yeah. So if you want to know how to examine yourself, I think they are stationed there between 2 to 6 p.m. However, just always remember that some people come to me to say, I don't know how to check my breast. That's the only reason they've booked the appointment. Then you can go to the GP. The nurses can show you. You can go to somewhere. You can also look online. Now, it's not just Instagram that we do on our phone. It's not Facebook. It's not looking at other people's lives. We can get information out there. Just be careful that you get it from a source that is reliable. The NHS has put a lot of information on their websites to empower us. Next slide, please. So that's the bowel cancer screening. You've heard what I said. Poo is not something that we like to talk about. People don't like to talk about it, but it's really important. Your next poo can save your life. So next slide. The bowel cancer screening. Bowel cancer is the fourth most common type of cancer. So, and the screening is usually between 60 to 74. But in April 2021, the government has decided to extend it to people who are 50 to 59. And I've heard people who said to me, oh, I got this thing through the post. I'm not old enough. We don't like to be old, I tell you. So please do it. Do not ignore it. Do not throw it away. It's really quick, and it comes with its instructions. You do it in the toilet. It takes, and people think, oh, that's massive I'm putting in, but it's really tiny, I tell you. So try it. So next slide, please. Ovarian cancer. I cannot not talk about ovarian cancer. It's the fifth most common cause of cancer death in women, and it doesn't have any screening yet. If you have a strong family history, it's all right to go and speak to health professionals because they can now direct you to genetic screening, and people can actually decide what they want to do for the future. Just like people decide these days if they have very strong family history of breast cancer, I want to have a preventative mastectomy, which just means they want their breast removed. People do it. Angelina Jolie is a great woman. I salute her courage, but she took her own destiny about health into her hands and chose to have her breast removed as well as her ovaries. Not everyone needs to do that, but one of the things is, let's face, you said some people look at themselves in the mirror. Pastor Zama said earlier, they see a problem, they don't fix it. So be aware, look at yourself. What do you need to address? Do not leave it till tomorrow. Just go for it. Your life is just yours. The only person you continue to meet the rest of your life is only you. You don't see your husband, not the kids actually. That's the thing. So you're the one, you owe yourself the most responsibility to look after yourself. So take a decision that is best for yourself, not the next person. Because it's you, it's your journey. So make sure you engage with screening. Hypertension, I'm going to talk about hypertension because we just ignore it. It's the commonest, it's very commonest long-term condition amongst the Afro-Caribbean and Black African society. No symptoms. So people walk around with it. The only way to find out is by checking your blood pressure. And you can check your blood pressure at the pharmacy. You can check at home if you buy a machine. You can go to the GP. So there's so many ways to check your blood pressure these days. And if you give you a reading that you're not sure of, contact a healthcare professional. The pharmacy, they're able to just do a lot of blood pressure these days, and they can do a 24-hour monitor if you need it. Control of blood pressure, it's really crucial to prevent stroke, heart attack, kidney disease. I saw a 45-year-old patient of mine who is actually Nigerian, and he doesn't mind me saying this. For 3-4 years, we kept sending him messages. Your blood pressure is not well controlled, you need to take your medications. But he didn't really do anything. He came to see me 2 weeks ago, and he said, yes, I left it. And then the next time I saw him about a month ago, I spoke to him, he had a stroke. He's young. And it's really hit him, and now he says, I want to talk about hypertension. So this is one of the things. You're going to feel well. If you don't check it, you won't know. And if you check it, do something. Do not ignore it. Next slide, please. So the risk for hypertension, being overweight can be, unhealthy diet, too much salt. And in our African community, we really do cook with salt. We love it. I like a good pinch of salt, but it's not good for us. Smoking, alcohol. But if you see, I said age and genetics. So if you have a family history of hypertension, it's very likely that you're going to develop high blood pressure as well. So look after yourself, look for it, seek help. Age, as people grow older, that's likely to happen as well. Next slide, please. Diabetes, very common. Type 1 is commoner in young people, so it's not as common. Most of the diabetes we have is the type 2 diabetes, but it is preventable. Next slide, please. So risk for diabetes, type 2 diabetes I'm talking about now, is the age. So people who are 45 and above, family history yet again, that's the genetics. Being overweight, gestational diabetes, and I talk about that for women who are of childbearing age. If during pregnancy they said your sugar was abnormal, it just means one thing. All of your life, for at least 10 years, you need to have your blood sugar checked every single year. First one after delivery will be at the 12 or the 8 weeks postnatal check. So if they don't tell you, remember to ask them, my blood sugar was abnormal in pregnancy. Do I need to do anything? Because you will need a blood test. And every single year after that, you will need a blood test called the HbA1c, but you don't need to know the name. Ask them questions. It's really important. The pre-diabetes is also one very important because it's towards prevention. So if you do a blood test and they said, oh, you're pre-diabetic, it means that you have the risk of developing diabetes. So engage with the program. There is a program that they will refer you to actually. It's for you to engage. Next slide, please. Vaccination. So I'm saying this to us today because I think we're one of the groups who do not really believe in vaccination, or we don't engage. Vaccination is meant to be protective. Vaccination dates back to years ago, and I think I shared this before. My great-grandmother had smallpox about 2 weeks before she was due to get married, and if you had one of those things those days, the quarantine then was that you're taken out of the place and you're kept somewhere which is far away from everyone. And when they went back there to drop somebody else, she was still alive. But it left her she lost her eyesight in one of her eyes. And she had this puckered face, which you see the scars. So the first time I met her, she was very old. She lived till she was about 98 or so. So I did meet her. And the things she said to me, we didn't, children, she's got one eye. What is that? We're just, we try to move away from that person. And she said to me, this thing, you won't get it because your parents will vaccinate you. Or, that was just what she said to me. So it's our responsibility to take up vaccination for our children, for measles, for mumps, for rubella, for all of the things, pertussis, which is whooping cough, for polio. I hear a lot of stories these days. As someone phoned me from Canada 2 days ago, she just had a baby, and she said, I belong to an online group where autism is linked to vaccination. That's the new thing. There's a lot of conspiracy theory. There's a lot of misinformation that tells you about vaccination and its link with autism. I just want to tell you that the doctor who actually talked about this years ago, and my colleagues are here to allude to that, I think, was struck off by the GMC. So was stopped from practicing as a doctor here because it wasn't found to be true. There were no evidences to back it. So it's good to vaccinate our children because you can prevent all these common childhood illnesses. If you don't give them the MMR and they get mumps, well, they're going to, if it's a boy, it will affect their testicles. And when they're 30 and they're struggling with fertility, you may have to explain to them, and you don't want that. Or they're struggling to get pregnant because it's kind of affected their ovaries. But these are all the things. The new vaccine is the RSV vaccine in pregnancy. I'll urge our women to try and take it up. When a child develops bronchiolitis when they're born, it's quite a severe illness. So vaccination is really important. There's a lot of misinformation on that on the internet. Empowerment through knowledge. I've said so much. Understanding your own body, communicating with healthcare providers, importance of regular checkups. So attend for everything that you're invited for. If you don't feel well, if you don't understand why you feel unwell, it's good to just listen to your body, go and see someone, and so you can get checked out. Have a healthy habit, and attend for screening. I emphasizing on attending for screening because we don't. We're really busy, and that's truly a woman's life. And it's even more difficult because a lot of us are really far away from family, and therefore you do not have support, and therefore you have to be at your job, you have to look after the kids. But remember, the day you become unwell, those kids suffer. The whole family actually suffers. So please do. Next slide, please. Where can you get support? Your GP, the pharmacy, sexual health clinic, NHS website. Just have a look. If you're not sure, it's really good that you ask questions. You have your church community. If things are not right, possibly be able to confide in one person, even if it's your pastor. What shall I do? I don't understand what's going on with me. As I said, I've seen people who actually had symptoms. I've had blood in my poo for months, and these are true stories, and it turned out to be cancer. Don't keep quiet. Don't be embarrassed. If you're not well, you're not well. It doesn't choose people because of what they've done. Things have just gone wrong, so it's all right. And that's it. Next slide. I think that's my entire slide now. Just going to say to all of you today, look after yourself, invest in your health, because that's the most important thing. When it fails, everything fails. Prevention is better than cure. Every small lifestyle changes, the small dances in the kitchen, going up and down the stairs, going to the gym for those who can afford it. It's really expensive now, you must acknowledge that. Whatever you can do is really important. For the women who are going through middle age, it's a time where people feel really insecure. I'm going to tell you that. You're not as secure as you used to feel. You look in the mirror. One of my receptionists at work said to me, I said, "You look great." She said, yeah. When I look in the mirror and it doesn't feel quite right, I just put on more foundation, she said. And then I said, and some more, she said, and some more. And then when I look, I feel great. So if that's what it takes, if it's more makeup, if it's a new dress, whatever, the smallest of things, find pleasure, find joy, find gratitude in the small things of life. Middle age menopause is a time of insecurity. Nothing is good, not the husband you said you loved and you wanted to marry, not the children God has blessed you with. And it's actually a challenging time because you've got young adult children and they're challenging. Yeah, so it's not the children. You begin to find fault in everything. My leg used to be straighter. My belly used to be slimmer. Just be confident in yourself. Whatever it takes to do that, just do it. Do it. That's what I'll say. I don't look the way I used to look, and I put up my hand to say, yes, I'm a woman in my 50s. My gray hair, my scars, my belly, that is not what it used to look like, just tells a story of me and the things I've gone through. But I'm here and I stand strong. So enjoy it and look after yourself.